We are not in the transactional health business. Fit and Trim understands it's a holistic, sensible approach to a lifestyle modification. And we have a huge social problem that we need to target, we need to understand, we need to be aware of. Most importantly, we need to disrupt the market. Hello, Fit and Trim family. My name is Rick Mejia, and welcome to the Ask Fit and Trim show. This is our episode 1. Basically, we're creating a show for all of our audience, all of our clients, and a lot of individuals that are seeking to learn more about all the protocols, procedures, and programs and proprietary programs that we work with Fit and Trim. Part of this video show, a video blog that we're creating, is a way of answering most of the questions that we get. Most of the times we do it one-on-one, and we try to follow a more personalized approach. But a lot of our clients have been saying, Rick, to our staff, that they would really enjoy if our message, our information would really get spread out and somewhat get more people informed about what Fit and Trim does. I've been the founder of a lot of these programs. I work directly with different medical directors. We work with psychologists, therapists, nutritionists, fitness enthusiasts, personal trainers. So we have a whole holistic approach to what wellness and weight loss and proactive health should become. So when you listen to us at Fit and Trim, you're going to get a lot of information that comes from different angles. It's not going to be very specific, but it's going to be more of an abstract form of looking at how things work. Okay, so the Ask Fit and Trim show is going to be basically answer specific questions. We encourage you to go into our social media platforms and ask any question you have. It could be whatever. It could be from pharmaceutical questions on supplementation, from vitamin therapies, immunotherapies, hormone therapies. It could be biochemistry questions. It could be holistic questions. It could be physical activity questions. Whatever the question is, we're going to try to get an expert on the area and answer that. Okay? So, just to give you a little background about myself, I founded the Fit and Trim concept back in 2011. Since this is the first episode, I kind of feel like it's only appropriate to give a better idea of who I am and why am I in this video. Okay, so in 2011 I came up with the concept that preventative health was pretty much in a gray area. We have different industries that fight somewhat to get the consumer into a healthier lifestyle, but most of them are what I call transactional procedures, which is basically the activity of selling you something without any value. So if you go into any social media, if you watch a TV show, or if you go into a store, you're just going to get a supplement, or you're going to see something that says buy this and your problem is solved. That's what I call transactional protocols or process. It's just meant for you to get a transaction out of it, but overall you're not really going to learn anything. You're not really going to change anything, and it's really wired into it for you to fail. Okay, so we have the fitness industry, which is naturally teaching you how to work out, get more fit, get more active, right? You have massive information on that. You have the supplement industry that are telling you take a pill, take a drop, buy a certain product, and boom, and detox. There you go. Your wellness and health problems are solved. And then we have the nutritional industry, which is all about what to eat. Teaching you, should you be no gluten, should you be gluten-free, should you be non-GMO, should you be a vegetarian, should you do the Atkins diet, should you do the South Beach diet. So the whole wellness and weight loss industry, it's in a battle within how are they going to get you to transact. Fit and Trim Medical was built as a center that has a support system with primary physicians. So basically what we do is we take a more proactive approach to preventative programs. So we work with doctors directly with patients that are dealing with chronic issues, and our number one pillar for everything that we do in Fit and Trim, it's more of a behavior pattern. How can we help you identify your fallacies, your cognitive biases, and how we can make you be more mindful on your process, on what you need to do, because everybody needs a different approach. Everybody needs a different program. We've developed a big contrast bias whenever we see the top fitness people or the top the top bodybuilders. We think that they got there just by taking some pill, by taking one little protocol, and that's a fallacy we created. It really takes a long time, and it takes a long process to realize what you need to do and how you need to get there. And most of our program managers and our coaches try to develop that mindfulness, consistent, that you are aware of where you are, who you are, be self-aware, and what are your biggest problems, what are your some of the things you need to leverage off, and that way we can put you on the right program. Okay? So, introducing that concept in 2011, we met up with a couple of doctors. We introduced the process of being a little bit more mindful, a little bit more educational, a little bit more one-on-one, a little bit more functional, a little bit more proactive, and so far we've worked with over 10,000 clients, with over 10,000 patients, and we've done an excellent job within that process. So I hope that when you look at this video and you look at our blogs and you look at our interaction, you find that we want to be part of this community, and we're not trying to transact here. We're trying to build up value for you. We're trying to introduce you to our concept, and hopefully if it's something you find that could give you a net benefit, you will suggest coming to us and maybe you know, getting somewhat of a one-on-one and seeing how our ideas play out. Okay, so within the shows, you're also going to get other program managers interacting. We have most of our program managers are psychologists. They have background in psychology, just like myself, and they work a lot on how do they make you you know, be more how can I put this in a perspective that's understandable? It's to put you in a state of mind, in a hyper-focused state of mind, that whatever decision you make about your health, you're actually going to stick to it, which is probably the biggest problem most people have when it comes to health, wellness, fitness, nutrition, etc. Okay, so for the Fit and Trim video blog / program, Ask the Fit and Trim Show, the first question that we're going to go through, which is going to be, I'm going to go very briefly because I don't want to get too detailed on it. It's going to be about the number one question we get asked. A lot of people within the last couple of years are asking about HCG and what it does and how it works. For us, it's more, we don't like to call it HCG, we like to call it a hormone therapy. And how this specific therapy really works and how does it work. So from our point of view, there's really not a lot of research or scientific studies that can really show does it or it does not work. So we found other studies that relate the effects of HCG and what it does to the body. And what we do know are a couple of things. HCG, when it's stimulated within the body, and the only way that we know you can actually get it through your bloodstream is by injectable. So if you're getting it on a pill form or if you're getting it on a drop form, your body's really not going to increase the HCG levels within your blood. So the HCG hormone therapy does a couple of things. Number one, and we wrote it here, don't ever take a product without calling it a therapy. Everything is a therapy. It doesn't matter what it is. If you're going to start working out, make it a therapy. If you're just going to start doing push-ups every day, consider it a therapy. Push-ups with what? What food are you going to eat? How are you going to wake up? How are you going to take it? How are you going to, how are you going to maximize it? How many push-ups should you increase per month, etc. Everything is a therapy. Hashtag that. Everything is a therapy. Everything, no matter what. So, looking at some of the main points of the HCG protocol, how HCG should work, is number one, we are completely against a 500 calorie protocol. That is absolutely destructive. It is catalyst for your body. It's what we call, it creates a state of catabolic stage. A catabolic stage is when your body loses most of its muscle. So basically you do feel like you're losing weight, but you're losing most of your muscle, which is very important for your metabolism. So if you're losing massive amounts of muscle and you're losing water weight, you're not really losing fat. You're not really rehabilitating your metabolism. So at that point, HCG is not as effective. Now, where HCG tends to be effective is if you're doing an appropriate protocol where your body's getting the nutrition it needs, when it's sustaining the vitality and you're getting the micronutrients it needs, it's getting you into what we call a metabolic stage, which is a hypermetabolic stage in which your body can burn fat consistently without sacrificing to protect the muscle, testosterone, and some of our thyroid hormones. Okay, so the most important part about weight loss is protecting the muscle. No matter what anybody tells you, if you do not protect the muscle, you're basically going through a catabolic stage, which is 90% of weight loss programs that are medically supervised. And even working out, most people work out and they don't even eat. Or after they work out, they don't have any type of recuperation process. So they're going into a catabolic stage, which is super inefficient, okay? So HCG is also known to decrease some of the hunger pains or decrease some of the cravings, which is very important when you're trying to detox from glucose and glycogen and just getting your body into a fat burning stage. So a lot of the patients that we work with, and a lot of the patients that I've worked with many other doctors with, have found that HCG does reduce those cravings, and it does reduce that need to get those extra carbs and the extra sugars, which are highly important in order for you to reach your goal. Okay, so how does Fit and Trim create a proprietary program with HCG? We basically become very mindful of the micronutrients that your body needs consistently. We do have a process and protocol of detoxing the body from the glucose glycogen effect, and just let the hormone therapy play a role in sustaining the muscle, lowering the cravings, and making sure we're resetting somewhat of the hypothalamus. Okay, so that's going to be the question of the first video blog of the Ask Fit and Trim. So those are the 5 main points of HCG, and for answering for you guys, it's very specific. Number 1, everything's a therapy. Hormone therapy, it's not an HCG diet. It should be a therapy. Number 2, it decreases hunger. So now you know we have that, I guess, broad idea that with all the patients that we've been working with, thousands of patients that we've been working with, and many doctors that work with the protocol, they have experienced a decrease on their hunger. Number 3, it creates an anabolic stage, not a catabolic stage, which is super important when it comes to weight loss. And of course, it protects the muscle. Okay, now before you do any types of therapy, doesn't matter which one it is, it's very important that you visit a wellness center or a center that has medical directors that can define how's your biochemistry, can do a physical, can do blood work, and all those things. Don't just go to a random person and suggest that you should get a bioidentical type of therapy without the proper approach to it. Okay, so if you guys have any questions, please visit us www.fitandtrimhealth.com. You can also email us at info@fitandtrimhealth.com. If you have any comments or anything you would like to add to it, that would be great. Remember, this is our first video. We're going to make it like somewhat of a series. I'm going to talk about vitamin therapies. I'm going to talk about lipotropics, vitamin B12. We're going to talk about nutrition, glucose, glycogen, the effects of the enzymes. We're going to talk about your body type, how hormones affect. We're going to talk about fitness. Should you work out at the beginning of trying to lose weight? Should you not? We're going to talk about conjugative biases, your fallacies. We're going to talk about neurochemistry. We're going to talk about traits, your DNA, genes, and the effects of them. So I hope you guys really enjoyed this show. I'm going to try to get a little bit more simplifying it, not so one-on-one, but really build a show where we are kind of having a conversation, kind of the way I have with my clients or the coachings that we do. All right, so video 1, we hope it creates a trend, and we hope you guys can begin to engage with Fit and Trim. All right, thank you so much, guys. This is Rick Mejia. You guys